This segment is brought to you by Manila Doctors Hospital.
年轻的 Claude Kubo 就像所有菲律宾的青少年，都梦想着当一位球员。慢慢的，他的打篮球梦想渐渐的实现了。
Naglaro ako sa mga palarong pambansa, tapos nag-tryout ako dito sa Manila na, or sa AIAC. 3 years din ako naglaro sa AIAC. Tapos noon, pagka-graduate ko, naglaro ako ng PBL muna sa Admix. Tapos second, Cobra, and the third is Powerade.
Claude 的篮球生涯很顺利，但是在2015年10月，因为第6次亲人犯规被迫出场。不幸，他的膝盖也受了伤。
Nung pagka-sidestep ko, bigla kasi siya nag-twist, bigla na lang bumigay. Yung ginawa ko yun, magpa-MRI. Tapos yung result ng MRI, binigay ko sa doktor. Ayun, nabasa agad sa findings na ruptured ACL ako, tapos meniscus tear. May meniscus tear din.
Well, the most common sa Philippines that causes mga injuries that orthopedics would have to get involved with is basketball. And sa basketball, although ankle sprain is the most common, the treatment of ankle sprain is non-surgical. So what we often manage na surgical are yung matinatawag namin ligament injuries of the knee. And this is what you call oftentimes that require surgery is yung anterior cruciate ligament tear.
Nung na-ACL ako, sinubukan kong maglaro, hindi na siya stable. Every time na aapak ako ng maling apak, bumibigay siya. Kaya hindi ko nung ganun nararamdaman ko, nag-knee brace, ganun pa rin, bumibigay pa rin siya. Kaya naisipan ko magpa-surgery.
If you've heard of some players who would have anterior cruciate ligament tears and they require surgery, because that is the only way to treat anterior cruciate ligament tears. Usually, ang ginagawa po ng orthopedic surgeon is we do arthroscopic reconstruction of the ACL.
2016年3月 ，Claude 暂时停止打篮球。
Nung sinabing ACL ako ng doktor is, parang nagdadalawang isip pa ba ako kung magpapa-opera. Sa isip ko parang gusto ko pa maglaro. Kaya nag-decide na lang ako magpa-opera.
So this is what we call the arthroscope part of doing the surgery of the anterior cruciate ligament. Basically, we have a small incision in the front of the knee and we let this go inside the knee to have a look. And there is an angle to it so that you can see all around the knee. So you just turn it around and you can see left and you can see right, up and down. And there's a second incision where we use the other instruments of the knee, where we can also do it arthroscopically with small incisions. So therefore, pag nag-o-opera, hindi na malalaking hiwa. Puro maliliit na lang. And imagine, how do you reconstruct that knee with a small scope? This is actually a technique that to do this with minimally invasive methods. So we actually create a hole here, and we pass the graft through that small hole, and we pull with another small hole, we pull the graft in.
Claude 知道他必须有坚韧的心，才能熬过这次膝盖的伤。
Ginawa ko noon sa rehab is knee strengthening, knee lunges, squats, tapos jogging, tapos pag-akyat ng stairs, tapos plyometrics.
还好开了一次微创手术，而保住了他的左膝盖。在经过8个月的调养复健 ，Claude 终于又回到了篮球场。
Kailangan minimally invasive. We do not want to add more injury or say make a big incision. So usually maliliit ang mga incision namin pag nagagawa kami ng sports injuries. Secondly, we want our patients to go back to sports. Hindi lang yung makakakain ulit o makakalakad. We want them to run, we want them to jump, we want them to go back to the sports that they were playing. So medyo mataas ang demand. Third, you want that the patient goes back to it fast. Kasi some of them are professionals. Some of them will also lose their fitness pag mabagal. Kaya kailangan, we have to find ways to make their surgery not so traumatic na matagal masyadong recovery.
This segment is brought to you by Manila Doctors Hospital.